Perfect. All right. Welcome, everybody. My name is Emma Foman. Thank you for joining us. I am the Chief of Staff of the Mayor's Office of Media and Entertainment, and we are delighted to have Dr. Rosen here from the Health Department to give us a presentation on the vaccine effort. So with that, I'll introduce our Commissioner, Ann Del Castillo.
Hi, good afternoon, everyone, and welcome to our vaccine town call for arts, entertainment, and hospitality. I just want to give a few brief remarks of introduction. I think we've probably seen a number of you over the course of the last year in various webinars and town halls, but for some of you, this might be the first time you're engaging with us. And so I just want to give a sense of what our office does and what we've been doing. The Mayor's Office of Media and Entertainment is really focused on supporting the creative economy of New York City, and that comprises film, television, theater, advertising, publishing, digital content creation, music, and certainly nightlife, where all of our major cultural movements have been born. You all on this call represent our creative community, our city's heart and soul, are really the economic engine that drives New York, and truly the key to our revival. And so I know that it's been a very difficult year for everyone on this call. And for the last year, we've really been focused on trying to keep you informed, connect you to programs, funding, other supports available at the city, state, and federal level, and then just bringing back the creative community as safely as possible as the state has rolled out its reopening plans. That started as early as last year with our hospitality community, restaurants and bars, first with takeout, don't hang out, making sure that patrons understood how to support their local restaurants, and then socialize responsibly to continue that momentum with open outdoor dining and open restaurants. And then in July, when film production started back up, making sure that we rolled that out in a way that made sense for the industry and our communities. And now here we are with live performance opening this week. The state has opened up live venues effective Thursday and Friday. And so I think you saw last week's announcement where we're really trying to stand up some supports for our live performance community. We're seeing finally a real possibility of getting all of you back to work. And certainly the vaccine effort is a big part of that. As of this week, I think something like 1 in 2 New Yorkers, and Dr. Rosen will correct me if I'm wrong, will have received the COVID vaccine. And so we really want to make sure that you have all of the information you need to get vaccinated. I, for one, am very happy to, as a government employee, was able to get my vaccine, my first shot a couple of weeks ago. And I was so excited that somebody was like, did it hurt? And I was like, I don't remember. I was just thrilled to be able to be in a position to get the vaccine. And I'm looking forward to everybody else on this call sharing in that joy. Hopefully you all know by now, eligibility opened up to people 30 and over as of this week. And then next week it opens to 16 and over. So very excited at what that means for the city and for all of you as we try to get you back to work. Though I know many of you have been working because you're all creatives, the work never stops. So with that said, I'm going to get the program underway. Please welcome Dr. Jennifer Rosen from the New York City Health Department. She's going to tell you the latest news about where we are with the coronavirus and share information about where we are with vaccinations. I thank you all for being here, and Dr. Rosen, I give you the floor.
Great, thanks so much for having me here. I'm just going to share my screen. Okay, can you see my slides? Yeah, great, okay. So just to start out with some background about COVID during this pandemic, people of all age groups and all race and ethnic groups have been impacted by this pandemic. However, more Black and Latino people have been sick, hospitalized, and died than any other racial and ethnic group. And these differences in health outcomes are due to many factors, including long-term structural racism, There are policies and discriminatory practices that prevent communities of color from accessing vital resources. And we know that the disproportionate impact of COVID on New Yorkers of color highlights how these inequities negatively influence health outcomes. Equity is central to our COVID-19 response and vaccine program, and we at the health department know that we need to earn trust, build confidence, deliver community-focused information and programming, and working together with the community, including people like all of you on the call, we know is key. And we commit to take action to address health and social inequities that have been amplified during this pandemic. The good news is that in the United States, over 140 million doses of COVID vaccine have been administered. And in New York City alone, over 4 million doses have been administered. So this is really a remarkable achievement in a relatively very short period of time, but we still have a long way to go. This slide, the figure on the left, shows the number of daily reported cases of COVID. And you can see very clearly the first peak that we experienced during the pandemic, and now the second peak that we're in, the second wave, which has far exceeded the first wave that we experienced. And on the right, you see a map of New York City, and the map clearly shows that COVID has occurred in all neighborhoods of the city. However, different neighborhoods have been harder hit than others, reflected by the darker red colors. We also have looked at vaccination coverage across the city, and on the map on the left shows that people throughout the city have been getting vaccinated, but vaccination is not equal throughout the city, and the neighborhoods reflected by the darker blue coloring represent areas that have had higher vaccination rates than others. And disparities in vaccination occur not just geographically, but have also occurred by race and ethnicity, with the highest rates of vaccination occurring among whites and the lowest rates among Latinos and Black people. Some key messages that we want everybody to walk away with today is that vaccines save lives. Vaccines are safe and effective, and they are provided at no cost. COVID vaccines are available to people of all immigration statuses, and vaccination is not a public benefit under the public charge rule. And finally, when people are vaccinated, their privacy will be protected. I'm going to talk a bit about how the vaccines were developed and how safety is monitored. So just for background, there are 3 phases of vaccine clinical trials that need to be done before a vaccine can be authorized. And these include phase 1 trials, which typically include a small number of people, usually fewer than 100. And then they expand to phase 2 trials with several hundred people, and finally phase 3 trials with thousands of people. So these are really large trials. And the phase 3 trials typically include half of the people getting vaccine and the other half of the people getting no vaccine or a placebo. And ideally, the study volunteers included in phase 3 trials, the demographics of the study participants should be reflective of the demographics of the people intended to receive the vaccine in the general public. And finally, after a vaccine is authorized for use, sometimes clinical trials can continue to assess longer-term outcomes and data from vaccine use in the general population. Vaccines must be reviewed and authorized by the FDA before they can be used. And in order to ensure the safety of vaccines, the FDA reviews clinical trial plans and protocols to make sure procedures meet the highest scientific and ethical standards. Clinical trials are closely monitored by data safety monitoring boards that are made up of outside experts and other groups. And FDA scientists and medical professionals evaluate all the available information to determine if vaccines should be authorized. We get a lot of questions about what exactly an EUA or an emergency use authorization is. Well, in an emergency like this pandemic, the FDA may allow vaccines to be used before they are officially licensed by issuing what's called an emergency use authorization, or an EUA, so that we can use the vaccines right away. No shortcuts in the testing of the vaccines are allowed, and all vaccines that are issued in EUA must go through the same clinical trials as all other vaccines. An EUA can be issued only if the evidence strongly suggests that the benefits outweigh any risks to patients. The COVID vaccines are being monitored more closely than any other vaccines in US history. The FDA, the CDC, and several other federal agencies and organizations continue to monitor the safety of the vaccines as they are being used. And again, at this point, over 100 million people have received vaccines throughout the United States, and much more than that globally. In terms of additional safety monitoring after vaccines are approved, medical providers are required to report certain adverse events that may occur after vaccination to the vaccine adverse reporting system. And vaccine recipients can also report side effects and other information to this reporting system or through CDC's Be Safe smartphone app, which you will be able to access if and when you're vaccinated. We also hear from a lot of people who express concern that the vaccines were developed too quickly, and people are concerned that safety may have been compromised in order to develop them so quickly. And that's not the case, but let me walk you through how the vaccines were developed so quickly. For one thing, scientists built on many years of research from other vaccines, including research on vaccines for other coronaviruses. The federal government provided billions of dollars to allow for the development, testing, and production to happen all at the same time. And for background, that's not how this usually works. Normally, vaccine manufacturers do the clinical trials, and if and only if the vaccines are approved for use by the FDA, then they will first begin to manufacture the vaccines. And that's because it's incredibly expensive to make the vaccines, and therefore it's cost prohibitive to do that in advance. But in this situation, the companies had the funding available to start manufacturing vaccines so that they were ready to distribute immediately when the EUAs were issued. Also, the federal government, the health departments, and healthcare providers were working for months in advance of vaccine approval in order to plan for storage, distribution, supplies, and other logistics. That way, vaccines were ready to be used as soon as authorization was approved. So at this point, probably everybody knows 3 vaccines have been authorized by the FDA for use, and that includes the Pfizer and Moderna mRNA vaccines and the Johnson & Johnson Janssen adenovirus vector vaccine. So I'm going to talk now briefly about how these different vaccines work. The Pfizer and Moderna messenger RNA or mRNA vaccines, they contain genetic material from the COVID virus, but they do not contain the actual virus, and they cannot cause COVID. And although the mRNA, it's a new type of vaccine, it's actually been studied for over 30 years. And this is how they work. So the mRNA enters the body with instructions on how to make a protein that is part of the virus that causes COVID-19. The proteins that are made then trigger the body to make antibodies and other immune defenses. And then the mRNA is broken down and destroyed by the body. It doesn't stay in the body. It's there for a very short amount of time. And then later, if a person is exposed to the actual COVID virus, the body recognizes it and produces antibodies to fight it. The Johnson & Johnson Janssen vaccine, it's a different type of vaccine. It uses an adenovirus vector. So to make this vaccine, scientists also took a gene from the virus that causes COVID-19, but they took this gene and put it into an adenovirus. And an adenovirus is a virus that causes the common cold. However, the adenovirus was modified so that it can't multiply in humans and it cannot cause disease. And just like the mRNA vaccines, the Johnson & Johnson vaccine does not contain the virus that causes COVID-19 and cannot cause COVID infection. So this is how the Johnson & Johnson vaccine works. So the adenovirus carries a gene from the coronavirus into human cells, which then make a COVID-19 protein. And then similarly to the other vaccines, for this vaccine, that protein triggers the body to make antibodies and other defenses. And then if a person is later exposed to COVID-19, the body is able to recognize the virus and make antibodies to fight it. For some background about the clinical trials for all three vaccines, the Pfizer and Moderna vaccines, those both were tested and approved for use as a 2-dose series, whereas the Johnson & Johnson vaccine requires just 1 dose. All three of the vaccines cause mild to moderate side effects. And for all three vaccines, the phase 3 trials were huge. They all included over 30,000 people. And importantly, all of the clinical trials had diverse representation from across different age groups and across race and ethnic groups. The Pfizer vaccine was approved for use in people aged 16 years and older, and for Moderna and Johnson & Johnson for people aged 18 years and older. In the clinical trials, all three of the vaccines were shown to be safe and effective across all gender, age, race, and ethnic groups. No one receiving vaccine died from COVID-19 infection, and all three vaccines were very effective at preventing severe COVID illness and hospitalization. Based on preliminary data from clinical trials, lab testing, and use since authorization, all three vaccines are also likely to provide protection against the new variants that are circulating. However, for some variants, the protection may not be as strong. At this point, with the hundreds of millions of doses that have been administered, we know a lot about the vaccines. However, there are still some things that we don't know, including how long protection from the vaccines will last and whether additional doses will be needed in the future. So we don't know yet, will this be like, will protection last lifelong, or will it be like the flu vaccine where people need to be revaccinated each year? That's still to be determined. We also don't know yet whether the vaccines are safe and effective for children because the original clinical trials that were done only included people aged 16 years and older. There are clinical trials that have since begun for people younger than age 16. And in fact, Pfizer just announced released a press release stating that they have positive findings in a trial that is underway for people aged 12 to 16 years. So the results sound very promising. The results haven't yet been published aside from their press release, but more to come on that. And we also finally don't know whether being vaccinated prevents people from spreading the virus to others. However, a growing body of evidence does suggest that fully vaccinated people are potentially less likely to transmit COVID to others, but studies are ongoing. And this is a little bit confusing. So the clinical trials that were done for the COVID vaccines looked at how well the vaccines work at preventing symptoms of COVID infection and preventing hospitalization and death. But COVID is tricky because it can also cause asymptomatic infection, so infection with no symptoms. And so we're learning more about that every day. So there's very strong evidence that these vaccines are safe and effective, and they prevent severe COVID illness. And this is important because people of all age groups have been hospitalized and died from COVID infection. And some people continue to have health problems even after they recover from COVID infection. The vaccine may protect the people around you and helps move us closer to ending this public health emergency and getting New York City back on its feet. Now I'll talk about steps to take in order to get vaccinated. At this point, everyone aged 30 years and older is eligible for a vaccine, and people younger than 30 in certain categories. So people in certain group living facilities, certain public facing essential workers, and people with certain underlying medical conditions. Very recently, it was announced that on April 6th, all people aged 16 years and older will become eligible. So this is exciting news. And just for the most current list of eligible groups, you can go online for the eligibility criteria. In order to ensure equitable access to COVID vaccines, the health department has been opening up vaccine sites in the communities most impacted by COVID, and working together with community-based organizations to help prioritize making appointments for the hardest hit communities. We're also making sure that New Yorkers have the information that they need in the languages that they speak. We're working closely with community-based organizations. We know that it's been challenging to make appointments, and certain groups benefit from assistance with that. And the agency is closely monitoring data and community feedback to identify needs and gaps in access. At this point in time, people less than age 16 years cannot be vaccinated. Again, those studies have started in this group, and we are hopeful that vaccines, as long as they are authorized by the FDA, we are hopeful that before the next school year, at least children aged 12 to 16 years might become eligible, and beyond that, hopefully younger age groups in the future as well. All other groups of people can be vaccinated. People with any medical condition can get vaccinated. Many clinical trial participants had underlying health conditions, and the vaccine was safe and effective for them. For certain groups, so pregnant people, people who are breastfeeding, and people with a weakened immune system, there's limited data about the safety and effectiveness of the vaccines, and that's because these groups were not included in the original clinical trials. That being said, these groups can still choose to be vaccinated, and the vaccines are thought to probably be safe in these groups, although we can't say for certainty because they weren't studied, but these are not live vaccines and they do not contain the COVID virus. And then, for anyone with questions, you can always speak with your healthcare provider, but again, people with any medical condition can choose to be vaccinated. There are many options for where people can get vaccinated. Some people can get vaccine through their work. There are locations throughout the 5 boroughs, some healthcare facilities, including some hospitals, federally qualified health centers, and pharmacies are vaccinating patients. But the best thing to do is to go online to nyc.gov to find a vaccine site near you and to make an appointment. The website to go to make an appointment is listed here, or for people that prefer to do it by phone, you can call the number listed here, and you will need to complete a New York State vaccine form before you get your vaccine. And then when you go, make sure to bring proof of your eligibility, which is becoming less of an issue now that the vaccine is open to anybody aged 30 years and older. And as a reminder, if you receive Pfizer or Moderna vaccine, make sure to make an appointment for your second dose. This is just a screenshot of the Vaccine Finder website, and you can type in an address or zip code to find a location near you. And with regard to the Pfizer and Moderna vaccine, these vaccines offer some protection after the first dose, but they protect you more after your second dose. And the vaccine is considered to have optimal effectiveness 2 weeks after the second dose. You do need to get your second dose at the same place that you received your first dose. And the 2 vaccine doses need to be the same type. So if you get Pfizer for dose 1, get Pfizer for dose 2. And the timing for the second dose depends on which vaccine you got. So if you got Pfizer vaccine, the second dose should be received 21 to 42 days after the first dose. And if you got the Moderna vaccine, you should receive the second dose 28 to 42 days after the first dose. Hang on to your vaccination card that you receive when you get your first dose and bring it with you for your second shot so that the vaccinator can just confirm that you're receiving the same vaccine type. It is important to know that most people do report some side effects after getting vaccinated, and these are usually normal signs that your body is building protection, and this is actually a good thing. Common side effects include soreness or swelling on the arm where you got the shot, headache, body aches, tiredness, and fever. Again, these are all very common. And the side effects, however, they're usually mild to moderate. They usually start within the first 3 days after vaccination and usually last for about 1 to 2 days after they begin. Side effects are less common in older adults, and actually for people receiving the Pfizer and Moderna vaccines, side effects are more common after your second shot. Again, side effects, minimal to mild to moderate side effects are very common and not a cause for concern. But if you do have any concerns, or if your side effects don't go away after a few days, or if the redness or soreness where you got your shot worsens after 24 hours, which would not be expected, then you certainly call your healthcare provider. And just remember, for the Pfizer and Moderna vaccines, you should still get your second shot, even if you have side effects after the first shot, unless your healthcare provider tells you not to. And you can always call 311 if you have questions about side effects. You may have heard about reports of some people having allergic reaction, and allergic reactions have occurred but are uncommon. Talk to your healthcare provider before getting vaccinated if you've ever had an allergic reaction to a vaccine or injectable medicine, or if you're allergic to any ingredient in a COVID vaccine. But any other type of allergy, like to food, pet, dust, pollen, and latex, those are not concerns for vaccination. I do want to highlight the differences between expected side effects after vaccine, things like we talked about, headache, muscle ache, feeling tired, as opposed to allergic reactions, which are not expected after vaccine. Allergic reactions usually start within minutes to an hour of getting the shot, and can include things like difficulty breathing, swelling of your face and throat, a fast heartbeat, a bad rash all over your body, dizziness, and weakness. Again, these are not normal side effects and could be signs of an allergic reaction. And that's why when you go to get your vaccine, everybody is monitored after vaccination for 15 to 30 minutes. But if you think you're having severe allergic reaction, call 911 or go to the nearest hospital. Getting vaccinated is the most important way to protect you from severe illness, hospitalization, and death from COVID. And we need to be cautious until more people are vaccinated and until we better understand how well the vaccines protect people around us who have not been vaccinated. So in the meantime, even after you're vaccinated, we're asking that everybody stay home if you're sick, continue to distance by 6 feet from others when you are out in public, wear a face covering outside of your home, and wash your hands often. And we will update our guidance when we can begin to ease prevention measures. I'll just add with a reminder to please take care of your mental health. This pandemic has been incredibly stressful for everybody, and the city does offer 24/7 counselors that are available, which you can access them by calling the phone number that's listed here or via text or chatting online. So thank you, and I am happy to answer any questions.
Okay, so we have a couple of questions in the chat. Thank you, Jennifer, by the way, sorry. Tag you, just doing too many things at the same time. There were a couple of questions about whether testing is still going to be mandatory for live performance that's also doing media production, and when live performance guidance is going to be available, which is a question that we've gotten sort of generally, not specific necessarily to vaccinations. And what I want to tell everyone here is we know that there are a few gaps between the media production guidance that is currently in effect and live performance guidance for venues that are opening as of tomorrow and Friday. And we have heard from the state actually yesterday that they will be releasing live performance guidance this week. And so, and that should address some of the gaps in that guidance. So, so hopefully in the next day or so, we should see that coming through. And as soon as we get it, we will make sure that everyone in the sectors that we serve is aware of that. Then there was also a question about the Broadway vaccination site, which the mayor announced last week. We will be opening in the coming weeks. There should be more about that within the next week or so. but it is underway. And in terms of who would be eligible there, it really is all live performance workers that would be eligible to get vaccinated at that site. In terms of specific questions about vaccinations, Dr. Rosen, hopefully you can answer this. For New Jersey residents working in New York City, what are the requirements for being vaccinated under the nonprofit category?
Well, in terms of vaccination in New York City, people who are eligible would either be people who are residents of New York City or people who work in New York City. So if somebody lives in New Jersey and does not work in the city, they would not be eligible to be vaccinated here, if that's answering the question.
Okay.
We have another question about family members being eligible for specifically for the Broadway site, which will support theater workers.
I don't yet know the eligibility criteria for that particular site. So I think that information is forthcoming. But in terms of, at this point, anybody age 30 years and older can be vaccinated. So even if a family member can't be vaccinated at the Times Square location, there are locations elsewhere throughout the city where people could receive vaccine.
There's another question about the vaccines and their protection against variants. Do you mind going into a little bit more detail about that?
Sure. So the first two vaccines that were approved, so Moderna and Pfizer, those clinical trials took place before these new variants were circulating. The Janssen vaccine, though, was done in multiple countries and was done a little bit later, so after these vaccines were in circulation. And there were some differences in vaccine effectiveness in different geographic regions, which is thought to be reflective of different levels of protection against certain variants. As an example, in South Africa, vaccine effectiveness was slightly lower, and the thought was that that may be because of the variant that's circulating there may not respond quite as well. However, the vaccines were all still have been shown to be effective against the variants, just potentially not as effective as they are against the original variant that was circulating. So there's still a lot to be learned about the new variants in general. And even if the vaccines don't protect quite as strongly against the new variants, the vaccines are currently the best form of protection that we have.
That's great. There's another question about whether it's safe to take aspirin, Tylenol, or Advil after your second dose.
Yeah, so people should not take Tylenol or Advil in advance of vaccination with the goal of trying to prevent symptoms. However, if you do develop discomfort and you need to, then you can take it after vaccination.
Perfect. And then there's a series of questions. I don't know, Commissioner, if you'd like to speak to some of these that relate to the live performance guidance.
Yeah, so there's a few that I'm seeing here, and they're somewhat related and similar. One having to do, and Dr. Rosen, I might need you to weigh in on some of this. Certainly a lot of it is dictated by state guidance in terms of like how media production and how live performance how live performance is supposed to work, right, in terms of guidance. But now that we're seeing vaccinated and unvaccinated populations, there's this question about whether there's going to be a different set of protocols. I do think that is largely going to be determined by the state. But in terms of testing protocols for media production, there's a pretty rigorous testing protocol. And I would think that would still be in place, whether or not, like, even with vaccinations in this transitional period, is your sense that, those testing, whatever the testing protocols were prior to vaccination would continue to be in effect in this next phase where we have a hybrid situation?
Yeah, it's a good question and a common question. I would certainly, as you say, wait to confirm to see what the state guidance is, but I do anticipate that for the foreseeable future, testing requirements will not change based on vaccination status for a combination of reasons. One, just logistically, it's hard to know who has been and has not been vaccinated, and to change protocols for different groups of people. But the other thing is, again, we know that the vaccines work really well against preventing symptoms, hospitalization, and death. But there is somewhat less known about how well the vaccines prevent asymptomatic infection. And likewise, as to some of the questions we've received today, it's not known whether protection against the variants is as strong as it is to the original variant. So for those reasons, I would expect that testing would remain the same for the foreseeable future.
Okay, and I would say the other part of that question was whether the quarantine protocols would remain the same as well. If someone tests positive in that environment.
Yes, if someone tests positive or if somebody has symptoms of COVID, then the protocols are identical in terms of the need to stay home. Because these vaccines are very, very effective, but no vaccine is 100% effective. So if someone has evidence of infection, then you're treated the same.
Okay. And then there were other questions about live performance, and I think it's two questions. One about whether live performance workers are eligible for the vaccine. As Dr. Rosen has stated, as of this week, people 30 and over, regardless of their profession, are eligible. And then, correct me if I'm wrong, but I believe next week is when 16 and over are eligible. April 6th. Yeah. Okay. Is when 16 and over. So regardless of your profession, you would fall into that eligibility category. In terms of the actual site, like I said, we're still in the process of locking down details on that. How you demonstrate that you're working in live performance, and all of the logistics around those sites. We hope to have more information for you in the next week or so.
That's great. We had another question here about providing information about COVID-19 testing resources for media companies. And I think this can be extended to the broader creative sectors in general, but for example, labs, nurses, other resources.
I'm sorry, you're asking what resources are available?
Yeah, I could be misunderstanding the question, but I think that it's asking, is there a way to share information about existing labs, testing companies, medical personnel, to share with industries in the sector?
Got it. Well, there are lists of testing locations where people could go to. On the New York City Department of Health site, you can go online for the list of testing locations, including health and hospitals and Department of Health testing locations. But if you're interested in, we may need to follow up online if the question is more about how can you find like a vendor to come to you. I'm not sure if that's something that the agency has information on, but if you want to contact me, Emma, offline, I can see if we can find out about that if that's what the question is asking.
And then I think there's another question about proving your employment as a live performance worker, and I'm assuming this is for accessing the vaccine. And so still a lot of questions about how we prove eligibility, but I think the general sense is that the Broadway location or the sort of Midtown vaccine location would be available for all live performance workers, and we'll make sure that everyone on this call and everyone that we serve kind of gets those specifics. But if it is consistent with the kind of industry specific vaccine guidance for eligibility, then it will likely be a letter from your employer, an ID card, a pay stub, those sorts of things, but we will make sure that that is clear once it's finalized. And then we have another question about, are we able to require those participating in a production to be vaccinated to help protect the performers? I assume that this will also fall under the state guidance, but do we have any sense there?
At this time, there have not been discussions about vaccine requirements at the state or city level, or vaccine mandates. And we do get a lot of questions about this from employers. And at this point in time, our advice is to promote vaccine through education, provide people the information that they need to know so that they can make an informed decision about vaccination and to help improve people's vaccine confidence. At this point in time, these are vaccines that don't have actual FDA licensure yet. They're authorized, but again, don't have full licensure. And the reality is, at this point in time, we don't have enough vaccine for everybody who needs it in the city. So, vaccine mandate at this point in time really doesn't make a whole lot of sense. That may change certainly in the future, in time to come, once there's more than enough vaccine available for everybody. It's possible in certain settings. Who knows, vaccines could be required, just like vaccines are routinely required for children in school. But at this point, we really want to just provide people the education so that they can feel comfortable getting vaccinated.
Great. Let's see here. We have another question. If someone is vaccinated and comes in contact with someone who tests positive for COVID, does the vaccinated person need to quarantine?
And the answer is no. So if you are vaccinated and exposed to a person with COVID, there is no requirement to quarantine. So not to say, again, no vaccine is 100% effective. And of course, if you were to develop symptoms, you should get tested and, proceed as if you may have COVID. But because the vaccines are highly effective, the state does not require such people to quarantine.
Great. Let's see here. There's a couple more questions about eligibility, and so I'll send the links and information certainly as the city rolls out the location that's going to be for live performances or live performers. We will share information specifically about that. And our understanding is that all of those workers in the live performance industry would be eligible to be vaccinated.
I will say I see a question from somebody asking about advice for vaccination in people that have underlying medical conditions. I think they're talking about maybe a pulmonary embolus, but frequent epilepsy. And we get lots of questions about people with all sorts of different medical conditions. And regardless of what your medical condition is, you can get vaccinated. These are not live vaccines. And the only contraindications to vaccine are related to people with specific allergies to ingredients in the vaccine. So people with any other medical condition can choose to be vaccinated.
There's also a question here about, and I want to make sure that I'm just going to state it out loud because we might need some clarification on the question. Someone is asking, we've heard a lot about the vaccines. What is the latest or most promising treatments? We may need some clarification on that, but if you've gotten that question before, Dr. Rosen, maybe you can tackle it. I'm not sure if they mean apart from vaccines or.
Yeah, so actually, I'm glad that you raised this point, because vaccines are not, don't treat infection. So if somebody's already infected, if you then later get vaccinated, it won't get rid of your infection. It will only prevent someone from getting the infection in the first place. There has been a lot of work on treatments for COVID, monoclonal antibodies, for example. There's been a lot of attention to, and different treatments have different indications. So some treatments are for people that are in certain risk groups, or for certain people who, some are for people who are hospitalized, some are for people who are not sick enough to yet be hospitalized. So certainly if you develop COVID infection, contact your provider, and they may or may not recommend treatment depending on your condition. And information is really changing quite rapidly. So hopefully no one here will become infected, but over time we anticipate that more and more treatments will become available.
We have another question that I think is helpful. It's specific to stagehands needing to be tested, but I think it's applicable to the full world. Do people need to be tested even if the person has had COVID in the last 90 days?
So it's a very similar question to the question about if somebody's been vaccinated before, should they still get tested? And I think people should continue to speak with their employers and look at New York State guidance. But I suspect that just as it's likely that testing requirements won't change based on vaccination status, that testing requirements won't change based on a history of past infection or your antibody status. And that's because similar to vaccination, people can become reinfected after natural infection. There also is, there are questions about waning immunity or waning protection after natural infection. And it's not known yet whether, it's possible that reinfection could be more common now that there are these new variants circulating. So again, for those reasons, I suspect that testing guidance will not change based on history of past infection or antibodies.
That's great. And then one other question I'm seeing here is, if a vaccinated person comes in contact with another person who tested positive, is it possible that the vaccinated person could become sick and pass the virus on to other people?
It is. For the reason that I mentioned, we don't know. Well, no vaccine is 100% effective, and so we expect that some small percent of people who are vaccinated could still get sick and have symptoms of COVID. And there is still that question about, could people still develop asymptomatic infection if they're vaccinated? So it is possible that somebody could become infected and pass along the virus if they're exposed, even if they're vaccinated. But we think that risk is much less than for people who are not vaccinated.
That's great. Other questions? I think you're on mute, Commissioner.
Yep, sorry. I know that there were some asking if this session was going to be made available after as a recording, and it will be. We'll certainly be sharing out that link. Between this and all of the other webinars that we're doing, we really want to make sure that people have access to this information. And so if you're not already signed up for the MOM newsletter, I definitely encourage you to do so. We really try to digest all of the guidance that's coming out about COVID and vaccinations and various city, state, and federal supports for businesses and workers. We really try to share that information through the lens of our community and making sure that you're getting relevant information that's most relevant for arts, entertainment, and hospitality. I think there are a couple more questions coming up. Okay, so in terms of the best contact in our office to ask about the Broadway site, we're going to send that out via social and the newsletter. It's a collaborative effort with the Department of Health, Department of Cultural Affairs, and City Hall. And so we will be making a major announcement about that. And then in terms of, folks that want to help with reopening, there are a number of efforts underway by various stakeholder groups. And I would point them in the direction of that. I know that we're going to be, we've been sharing information about the vaccine for all core. We've been doing some recruitment for that. And just really helping us to spread the word about the vaccine efficacy, encouraging people to get vaccinated, encouraging people to continue to follow the protocols of mask wearing, social distancing in this period of reopening. I think, that's the one thing I hope that people take away from this session, is that it's really important that we continue to adhere to those protocols. And I'm sure Dr. Rosen would say the same. I don't want to steal words from you, but just from what we've been seeing, it's really important that as we're reopening, that we continue to be vigilant because we really want to see a successful reopening of New York City. And it's going to take everybody following the proper public health guidance and protocols in these coming months, when I know that everyone is excited to just get back out and be with their communities and take advantage of the various opportunities that are reopening in the city between outdoor dining and live performance. But we really want to make sure that we're still taking the proper precautions.
Great. Well, with that, I don't know, Dr. Rosen, if you have any final thoughts, but we will, as the commissioner said, we'll certainly share this presentation and recording with on our website and with everyone on this webinar so we can amplify. But go ahead, Dr. Rosen, if you have any closing thoughts.
Oh, I just wanted to say thanks so much for having me here and the opportunity to speak with everybody.
Really appreciate you taking the time and really appreciate everyone joining the call. And, we hope to be able to come up with some more good news in the weeks and months to come. Thank you all for everything you're doing to keep everyone safe and to stay informed. Stay safe, everyone.